My name is Gillian, and my family receives services from PRS's Family Peer Support Partner Program. I feel fortunate to have had a PRS Family Peer Support Specialist, even when I didn't know what that was or that I needed one. In fact, I can never even remember that title. I just call Janice our fairy godmother. She appeared out of nowhere 3 years ago, and though we've officially transitioned from her caseload, I know if I ever really need something, she's still there for us. My oldest daughter was adopted over 10 years ago, and over time we've realized that she has a brain injury, probably from childbirth. We spent years working through her apraxia of speech, seizures, cognitive development issues, but by 5th grade she was becoming increasingly aggressive at school, and it was interfering with her learning and that of other students. The school was quickly at their wits' end, and the stress for us of figuring out what to do next was coming to a head. In March 2019, I got an email that said, "Hi, I'm the family support partner that will be attending your family resource meeting on Wednesday. A family support partner is a professional who's been trained to work with families of children with behavioral disabilities. We are also parents of children who have behavioral or mental health issues. The meeting will explore information and resources that may be helpful for your family and create an action plan for your child. My role during this meeting is to support your family, make sure your voice is heard, and possibly provide information that may be helpful." I had no idea who this person was or how she had come to us, but it's hard to overstate how important it is as a parent of a child whose behavior is so out of control to hear from someone who's been in the same position. It's embarrassing, you feel guilty, and it's very isolating. To know that this person not only understood where we were coming from, but was just there to support us, meant everything. And as promised, Janice came to that meeting and the next one and all the others as our daughter's behavior continued downhill. She did indeed provide helpful information, sending us resource after resource, listservs, summer camps, respite options from others, and so on. When COVID hit, as for so many parents, we hit the worst period yet. My daughter was just about to change to a new school that seemed ready to handle her behavior. But with virtual schooling, her aggression increased, and it turned towards me. I knew she wouldn't intentionally try to hurt us, but 2 or 3 times a week she was so out of control that I'd end up putting our pets in a room with my younger daughter and telling her to lock the door. After I had to call the police more than once, my husband stopped feeling like he could go to work on a regular basis. It was our worst low. I called Janice for help, and she jumped into action. She helped us get wraparound services through our community services board, and while my daughter was hospitalized and we considered residential treatment, she researched options for us and helped me swim through the sea of acronyms. And because she knew all the people we were working with, she really made me feel better about each step in the process. I often say that the hardest thing about having a kid with disabilities isn't necessarily finding support. It's stitching together all the resources that are available while trying to hold down a full-time job and tend to the rest of our family's needs. It feels like being in a labyrinth and not knowing which way to go to get to the exit. Having Janice to light the way and even just to listen made a huge difference. And I'm pleased to say that this past summer, after a year of better medication, full-time school, and markedly improved behavior, our family graduated from wraparound services and from our family specialist. And while I was sad to lose Janice from our lives, I know that there are other families who don't know who she is or that they even need her, who will soon be meeting their family's fairy godmother.